about 9 in the morning, the first triage nurse nicely, calmly said, "We have a code critical in the driveway."
What happened, sir? What's your name?
He's losing his color. So I immediately felt for a pulse, didn't feel one. So we started compressions.
We just brought him back to the room. One of the doctors was there setting up the defibrillator, and we shocked him.
Heart disease accounts for 1 in every 4 deaths, making it the #1 cause of death of both men and women nationwide.
The leading cause of death nationwide.
It costs over $207 billion a year in the diagnosis and treatment of heart disease.
$7 billion. Someone has a heart attack every 42 seconds in the U.S.
Cardiology was immediately called. That's their area of expertise, so we hand off that care to them. He was stented, and he went home within 2 days.
Being part of that and helping him get back to his family makes you realize what you're doing as a career is pretty amazing.
Cardiovascular care over the years has changed dramatically. Back in the day when someone had a heart attack, the standard of care was bed rest for 2 weeks.
Cardiac surgery back then was sort of infantile-like. So if people needed something done, there was no option for medical treatment. It was bypass surgery only. Now today, there's so many options.
With the amount of cardiovascular disease and the way it affects the community, St. Joseph is on the leading edge of cardiovascular care.
If you think of St. Joe's, we've done a lot of firsts. First bypass surgery in Orange County, the first angioplasty in Orange County, the first women's heart center in the state of California. It speaks to St. Joe's Hospital that we are a leader in interventional and structural cardiology, a leader in community-based cardiology. So it's just kind of what we do.
One day in 1959, my buddy said, "Do you want to go out to Disneyland and look for a job?" So I went out with him. I started out polishing 3D glasses behind the Mickey Mouse Theater. Little by little, I got recognized and moved up the ladder and became president of my own division. Then when I came back from opening Euro Disney in 1992, 1993, I had a quintuple heart bypass. I've had over a dozen stents and lots of angiograms. Disney was always the standard for me on how people should be treated, and St. Joseph did Disney better than Disney could in so many ways. Besides keeping you alive, they just treat you well.
When Jim came home from St. Joe's after his first meeting with Ty Cobb, I was so grateful to have that support of Ty and the nurses. It really made a difference, not just for me, but for our kids. It left us with a lot of hope.
The opportunity for us to help improve people's overall quality of life, in particular through our structural heart program, have really been able to give many people in our community a new lease on life.
The structural heart program is a program that is designed to take care of patients that don't have typical cardiac disease. We do the transcatheter aortic valve replacement. We do a mitral valve repair with a mitral clip procedure. We do some procedures where we close defects in the heart.
Before this, patients had open heart surgery, which is an excellent procedure. But basically what we're doing is a procedure that's a little bit quicker in time, with less stress on the body. The patient recovery time from these minimally invasive procedures is a lot quicker. If we put an aortic valve in somebody, we usually do them on Tuesdays. Most of our patients go home the next day.
Another piece that is important to mention is the prevention part. I think for all of us, we'd rather prevent a problem from occurring than have it treated after it's already happened.
At the Dick Buckus Center and the Cardiovascular Wellness Center here at St. Joe's Hospital, we develop screening programs. Part of it is coronary calcium screening, which is the single most accurate predictor of heart attack risk for people without symptoms who have a risk factor. You want to see if you can intervene early and change things.
In addition to the excellent care that St. Joseph Hospital provides through screening and procedures that we provide, we also have the excellent Women's Heart Center. Women can come and be screened for heart disease.
The majority of people that come to us after a heart attack have significant lifestyle changes that they need to make. And cardiac rehab clearly plays a role in that. It's provided here at St. Joseph after every heart attack or myocardial infarction.
On February 12th, my daughter brought me to the emergency room at St. Joseph's Hospital. They examined me and they eventually found out that I had severe aortic stenosis. So they performed a TAVR procedure to add a new valve to my heart. What is so good about St. Joseph's is that you go into the ER, then they take care of you there. You have your operation, and then you can come back and continue with recovery in the same hospital. Rehab strengthens my body, so by coming here, I can do all the regular things that I used to do, and I'm getting better by the day, you know, I can feel it.
Right now we're living in an era where medical knowledge is doubling almost every 4 years, so it's tough to keep up. I think the things in the future is going to be unbelievable.
The technology provides us the vehicle, but it's the support staff that allow us to then use that technology to help patients live better lives.
The day started off just normal. We had lunch brought in by a vendor, and I started feeling like I had heartburn. My boss showed up, and she said, "What's going on?" I says, "Well, I feel like I got really bad heartburn." She goes, "Okay, I'm gonna call a code. I'm gonna have somebody come over here right away." So they showed up with a gurney and all kinds of medical people, and they determined that they needed to get me over here right away. They ran me through this hallway, and it was lined with people just watching to see what was going on. When they had me in emergency, the doctor, Dr. Kolsky, looked down at me and he said, "Don't worry, Tim, we take care of our own." From that point there, I was pretty confident that I was in good hands.
Tim basically came in shock, and nationally the average for mortality with cardiogenic shock is 50%. So obviously we were very concerned. Luckily for Tim, we were able to get him urgently to the cath lab and get him fixed up. His heart recovered completely, and he was able to be discharged within a couple days, which is unheard of with this condition.
It's an amazing feeling to see somebody who was really near death and then comes back in 24 hours, can live a normal life, have a normal family. It's nice to be successful in what we do, and we are successful at this hospital.
For St. Joseph to continue to be in this leadership position in cardiology, obviously they have to be able to recruit the physicians necessary to provide the services, and very importantly, to have a facility that is state-of-the-art.
The operative suites and the cath labs are where we take care of patients, and we're limited by some of the space. So now in order to grow and in order to provide that same excellent care that we've already been providing, we need help.
When we invest in this hospital here, it's personal because it's our community, and our patients become our friends, and we want the best for them.
Grateful patients, and I hate to say it, but the patients to be in the future are a member of our team. When they give from their heart, many of them feel that they really are there with all of us, arm in arm, fighting the battle against cardiovascular disease.
Without the work that St. Joe's does, I just can't imagine people like me surviving. Without them, I would never see my grandchildren. I may see my great-grandchildren, and what a gift St. Joseph gave me.